Since 1988, the international community has marked World AIDS Day on December 1st each year. This day serves as a global effort to raise awareness about the AIDS pandemic stemming from HIV infection and to honor those who have lost their lives to the disease. Governments, health officials, non-governmental organizations, and individuals worldwide participate in commemorating the day, often engaging in educational activities related to AIDS prevention and control. The World Health Organization has designated this year's theme as Let Communities Lead. According to the WHO, this theme recognizes the significant role that communities have played in shaping the response to HIV. The Director of National AIDS Secretariat, Ms. Adama Drame, emphasized the day's significance in reflecting on progress, raising awareness of ongoing challenges in achieving the goal of ending AIDS by 2030, and urging collective efforts for a successful HIV response.
This annual event reminds us of the global effort to end the stigma related to HIV, honor those we've lost, and motivate us to keep working towards until HIV is no longer a threat to public health. Remembering will give us strength to fight the disease and support those with HIV. Remember the importance of compassion, empathy, and solidarity in tough times.
World AIDS Day provides an opportunity for both public and private partners to disseminate information about the current status of the pandemic and encourage advancement in HIV/AIDS prevention, treatment, and care worldwide. Over the years, it has become one of the most widely recognized international health days, offering a crucial platform to raise awareness, remembering those lost to the disease, and celebrate achievements such as improved access to treatment and prevention services. The country director of the United Nations Program on HIV and AIDS, Mrs. Sirandao, highlighted the importance of community leadership. Communities, she said, play a crucial role in connecting people with public health services, fostering trust, driving innovation, monitoring policy implementation, and holding service providers accountable.
Communities have been held back in their leadership due to funding shortages, policy and regulatory challenges, capacity constraints, crackdowns on civil society, and on the human rights of marginalized communities. These are obstructing the progress of HIV prevention and treatment services. If these obstacles are removed, community-led organizations can add even greater impetus to the global HIV response, advancing progress towards the end of AIDS.
Despite the challenges within the HIV program, the program manager of Action Aid International, the Gambia, Mrs. Mam Kumbandao, emphasized the success they achieved.
We have registered successes in terms of uptake for HIV treatment services. We've registered successes in terms of uptake for HIV prevention services. However, we have also seen areas that we need to improve on, and we are working with everybody to improve on that.
The program manager of the Gambia National AIDS Control Program, Pa Usman Ba, provided statistics on HIV in the Gambia, underscoring the ongoing significance of addressing this global public health issue.
The prevalence for HIV in this country is at 1.52% based on the National Sentinel Surveillance of 2020. And the estimated number of people living with HIV is over 26,000 people, but we were able to diagnose only 51% of them, which is around 14,000 people that we were able to diagnose, which is almost about 55%. And then for those on treatment, we were able to put almost all those people who were found to be positive, we were able to put almost 61% of them on treatment. So you can see our target is the 95s, 395s, diagnosing people, 95% of people living with HIV and AIDS, putting 95% of them on treatment, and also making sure that the 95% of those who are on treatment are virally suppressed. But as we speak now, we are far from the targets of 95.
As of 2020, AIDS has claimed the lives of between 27.2 million and 47.8 million people worldwide, with an estimated 37.7 million people currently living with HIV. These numbers underscores the crucial importance of sustained efforts to combat HIV and AIDS on a global space. Reporting for Kerfatu, I am Buba Gajigo.